Hi, I'm presenting the impact of COVID-19 on organ donation and transplantation in Saudi Arabia. I'm the Executive Director of Clinical Services at the Saudi Center for Organ Transplantation, which is the governmental body supervising all activity related to donation and transplantation in the country. As disclosure, I have nothing to declare, and you are welcome to share details of this presentation on social media. Here is based on the Global Observatory Donation and Transplantation published by WHO and ONT. You can see that Saudi Arabia has an active organ transplantation program performing around 40 organ transplants per million population per year. In yellow, the majority is in the form of kidney transplantation, followed by liver in green, and then at lower scale, heart, lungs, and pancreas, bowel. So we have a governmental transplant center accredited to practice the organ transplantation. We have 11 kidney transplant centers all over the kingdom, covering the capital, eastern, western, north, and south. But as in liver transplantation, we have 4 accredited transplant centers, 3 in the capital Riyadh and 1 in the eastern Dammam, 1 lung transplantation in Riyadh, 3 for heart transplantation, all in Riyadh, and 2 for pancreas, 1 in Riyadh and 1 in Dammam, in eastern province. Here is the situation of COVID by using the WHO data. You can see here Saudi Arabia almost jumped from the middle light blue to the dark blue, but not the darkest one, between 500 to 5 million cases. We just exceed the number of 500,000 of confirmed cases, and with the death censor, 8,500 cases. We have the Saudi Arabia has a proactive approach regarding the COVID disease. We have a daily update provided via this platform, informing all citizens about the disease. And also we have censored the number of deaths, number of recovered, and most important, the number of ICU occupancy in hospital. And you can see here, based on this graph, we reach almost 80% of ICU resources in the month of June. More than 2,200 cases occupy due to COVID in the ICU, then start to decrease, well controlled. And in the second phase, we reach up to 1,000, and currently less than 800 cases admitted in the ICU. So in the timeline, after the first recorded cases in Saudi Arabia on 2nd of March, implementation of 24-hour lockdown happened and suspension operation nationwide, excluding the essential sectors. So within 2 weeks, the suspension of elective living transplantation happened in Saudi Arabia, and almost all deceased kidney transplantation only limited to the few centers active. We issued the first statement in less than 1 month about how to deal with the donor and recipient with the COVID-19, and this statement were updated according to circumstances. So as an approach to any deceased donor, all should be tested. In case of negative, even after it's negative, we have to have a risk assessment. In case of high risk, to repeat the test and only to clear and give the agreement for operation in case of negative. And all this COVID tested should be done through the respiratory and tracheal. The same for transplant candidate, should be tested in case of positive to stop, if negative to evaluate the risk, and in case of negative to agree for the operation. Here is the transplant center with the approach of living transplantation. So almost all transplant centers stopped the practice of living transplantation in months of March, and within 6 months stopped even living and deceased, and regained the activity on elective cases only after 6 months of suspension. If we look on our data, look on the critical pathway for deceased organ donation, we have a number of reported cases decrease around 30%, which affect the number of consented cases, 74 cases compared to 126 year before, and this affect the number of actual and transplanted cases compared with the previous year. And the number of organ dropped by deceased kidney organ transplantation, 72 kidney transplant compared to 140 year before, 50 liver compared to 78, 28 compared to 46 heart transplantation, and lung 35 lung compared to 70 year before. So all in all, the deceased organ transplantation decreased from 343 to 188 organ transplant, but at the same time, significant decrease in the living transplantation from 1,200 to almost 800 cases of living organ transplantation. So if we look into IRODAT, International Registry Organ Donation and Transplantation, we used to be on the 3rd world rank in the living transplantation, practicing around 36 organ transplant per million population, and to drop in the year 2020 to 20 organ transplant per million population. And also the deceased donation dropped from 3.7 to almost 2 donor PMP. At the end, we have to admit that the impact of COVID-19 on donation and transplantation activity is multifactorial, starting with the decrease of donor possibility because decrease of number of hospital admitted, and the critical pathway as well is affected because less number of possible donor. We have the COVID-19 positive donor, and also in the organ utilization with risk of infection, recipient exclusion, and the logistic of recipient that could not reach the transplant center during the curfew period. And also an important factor is the staffing, because the COVID-19 positive infection among coordinator and transplant team, and also the task to educate and train toward COVID-19 protocols. So in conclusion, ladies and gentlemen, the performance of the organ donation and transplantation programs are a good thermometer of what is happening in hospital. Significant impact on organ donation and transplantation activity during COVID pandemic, but it is a key factor to follow international recommendation, and safety measures are taken through recommendation guidelines provided by Scott during this era. Thank you very much.